So we are watching the Christ Medicus Foundation mission video, and the Christ Medicus Foundation is an organization that really helps healthcare professionals live out their faith in the medical industry. And so through that, they provide them with information and resources and really just support that they're not alone in this desire to live out their faith in their industry. So the purpose of this video was to explain to basically anyone who's willing to watch kind of the problems and the struggles that we don't know about or don't see because we're not in the healthcare industry. And then the really good work that the Christ Medicus Foundation is doing to help those people and to give solutions to that work. So we worked with them a lot before we even started filming, kind of in pre-production, scripting it, and really figuring out how do we show the problem and then show the solution. So we chose to do that in kind of like this hybrid of scripted content, and then also kind of this really beautiful testimony that their executive director Lewis gave and kind of an interview setup. And it was really cool because he and the rest of his team all came into the studio and we got to interview him and hear why he's passionate about what he does, why he got involved with the Christ Medicus Foundation. And I think that really adds to the video and really helps communicate to the viewer how important this topic is and how important the work that they do is. And throughout the video, we used a lot of B-roll, and most of the B-roll is actually stock footage. And we chose to use stock footage because it really allowed us to showcase multiple parts of healthcare. So there's hospital footage, there's doctor's office footage, there's medical students, there's all this array that like we otherwise wouldn't have been able to do. Like we wouldn't have been able to travel even within our state to get all this different footage. So we really love to use stock footage when it helps to elevate the video and helps to bring across the client's vision. And so throughout the piece, kind of there's the section of the problem that exists within the healthcare industry, and then the solution. And so in order to kind of help convey that, we have like a really a shift in music when we start to talk about the solution and what Christ Medicus Foundation is striving to do. And so that was something that was really important to them, is to have Christ Medicus Foundation be this very positive and uplifting presence in the healthcare industry. And so they were just a joy to work with. Lewis, their executive director, just has so much passion. And it was just, we love when we get to work with the client and have them be on screen explaining what they do. And so it was a really, really fun project, and I learned a lot. So thanks for watching this Filmmakers Breakdown, and hope to see you next time.
Every person is unique, unrepeatable, infinitely worthy of dignity and respect.
This truth has given birth to our greatest healthcare innovations and institutions.
And raised up champions for life, dignity, civil rights, and freedom throughout the centuries.
This truth has always faced opposition. People are dehumanized and marginalized,
stripped of their freedom, dignity, and rights by a throwaway culture.
Religious liberty is challenged. Life, dignity, and civil rights are under attack.
And over again, we see these attacks targeted at healthcare.
The right to life, the civil rights, the dignity of the most poor and vulnerable is under attack. And a large part of how we safeguard the life, the dignity, the well-being of those that are most vulnerable is by protecting that right of medical conscience, that right of religious freedom. Too many undergraduates, too many medical students in the United States who are people of faith, who are people of ethical and moral religious convictions, are afraid to go into certain aspects of healthcare because of their beliefs. Too many of our medical doctors and nurses and physicians' assistants have experienced coercion, fear, isolation, discrimination, in some cases, termination because of their beliefs. The very reason why so many medical professionals went into the healthcare arena, which is their moral and religious conviction that they had an obligation to love the patient, to love the sick and the suffering, is being attacked. Through the grace of God, the Christ Medicus Foundation is leading a movement to defend conscience and religious freedom in healthcare, to build up and empower pro-life and Catholic healthcare across the country that can heal the human person and that can provide a Catholic healthcare option that gives people the love and the care that they need and that ensures that they're able to receive and pay for that medical care consistent with their moral and religious convictions.
We are the Christ Medicus Foundation. We believe that each person made in the image and likeness of God has infinite worth.
We advocate for the rights of conscience and religious freedom in healthcare for patients and medical professionals.
We offer a pro-life healthcare option to individuals and families through CMF Curo, praying with members and supporting them in their healthcare needs.
We offer strategic guidance and support to pro-life and Catholic healthcare centers.
We are unabashedly Catholic and defend the right to life in healthcare at all stages.
We are the Christ Medicus Foundation. Join us in this fight.